Hello friends, let us now learn some important points. First we will see the classification of medium vessel vasculitis. If you see in the medium vessel vasculitis, we have three main diseases. So in this we have polyarteritis nodosa, Kawasaki's disease, and we have Berger's disease. Okay. So first in this chapter we will learn about polyarteritis nodosa. So this is poly is many, arteritis is involving many many stages of disease, and nodosa you see many nodes. Okay, so what is happening here is this polyarteritis nodosa is a medium vessel disease. This is actually the most common, this polyarteritis disease, it most commonly involves the kidney, but in this polyarteritis nodosa does not cause glomerulonephritis. Though it most commonly involves kidney, it does not cause glomerulonephritis. One important thing here is this kidney is the most common cause of death also. The most common cause of death occurs due to the kidney failure, or renal failure is the most common cause of death in polyarteritis nodosa. Then one important thing is here the pulmonary vessels are completely spared, and this polyarteritis nodosa is associated with hepatitis B surface antigen in almost 30% of patients, right? So if you see the microscopic examination of this polyarteritis nodosa, you will see presence of segmental transmural inflammation. I will just make a picture of this. With fibrinoid necrosis is seen. There is segmental transmural inflammation with fibrinoid necrosis is seen. That means if you see, this is the vessel. If you take into consideration, this is the vessel. Here you will have the transmural, that is involving all the all the layers of the vessel. Here there is an inflammation, here there is an inflammation, here there is an inflammation. So this is segmental and it is transmural inflammation, and you will also see presence of fibrinoid necrosis. So this is about polyarteritis nodosa. Thank you for watching.